Okay, hello. I'm Dr. Shah with 360 Urology. We're a urology practice located about 15 minutes from the Atlanta airport in a city called Stockbridge, Georgia. We'd love to see you, hear from you. If you ever want to come by and pay us a visit, ask us questions, we'd love to see you there too. Now today's topic is prostate cancer survivorship. This is where my heart and soul is at. It's something that I'm very passionate about. In fact, I travel across the globe to countries like South Africa to try to teach them how to manage prostate cancer patients after their treatments and try to get them recovered from a quality of life standpoint and from a healthy living standpoint. Now, the first thing we want to talk about is how do you manage your diet? What do you do? Do you exercise? What are next steps? Now, diet and exercise are incredibly important after you've had any kind of cancer surgery, and prostate cancer is no different. You want to maintain a healthy lifestyle. You want to move towards a cardiac or heart-friendly diet, something like a Mediterranean diet. You want to implement exercise into your routine. You want to try to keep yourself healthy, try to rebuild those muscles, try to get your health back in order. There are links between obesity and prostate cancer. There are links between smoking and like recovery from prostate cancer treatments. So all these things matter. So cutting back on smoking, enjoying a healthier lifestyle, these are things that are going to get you recovered quicker. Now, PSA screening is important, so you want to keep an eye on your PSA and you should continue to follow up with your urologist. Make sure they're keeping check on your PSA. That's going to be a really important aspect of your recovery. Now, when we say diet and exercise, well, one of the complaints or problems that patients experience after prostate cancer treatment is, hey, when I exercise, now I'm starting to leak, right? We call that stress incontinence. Well, let's talk about that. Another thing that impacts your quality of life is loss of erections. And that's a common occurrence after prostate cancer treatment. So let's talk about that. So let's say we split this up into two common problems that we see after prostate cancer treatment. The first one is stress incontinence. And the second one is erectile dysfunction. Now, why do you get stress incontinence? If this is your prostate, this is the channel you pee out of. This is your bladder, this is the channel you pee out of, and here's your prostate right at the opening. Here's the sphincter muscle, that's that muscle you train when you're a baby, and it allows you to control by closing the channel and open by opening up the channel when you pee and don't pee, right? And you usually control that with your brain. Now, there are two reasons why you don't leak or didn't leak when you had a prostate. Your external sphincter, which is that sphincter that you can control when it's open and when it's closed. When you do kegel exercise, you're really controlling that sphincter. And the internal sphincter, which is the part of the prostate, it's that inner bladder neck area, and that naturally reduces by providing resistance. It keeps you from leaking. Okay. Well, when you have prostate cancer surgery, this is removed. When you have radiation, this area is radiated, and that can fixate or mess up that closure and opening mechanism in this area. Now, once this is removed, well, now you're really just dependent on this external sphincter right here. So 100% of the work is going to be done by this. What do you want to do to prevent yourself or reduce the chance of stress incontinence? So we always recommend working this out early. We have pelvic floor therapy chair options here where you can sit on a chair and it makes your sphincter muscle do 25,000 kegels in a 30-minute session. You can do kegels yourself just by simply squeezing that muscle that keeps you from peeing. It's almost like when you're trying to pee, that muscle that stops your pee in the middle, that's the muscle you want to squeeze. You want to squeeze it, hold it 5 seconds, let go. You want to keep doing kegels, try to strengthen this. You can work with a pelvic floor therapist and they can teach you how to tighten and loosen this muscle and exercise it so that you can build up that muscle. So pelvic floor therapy is one of the hallmarks of this treatment process. What's another common treatment? So let's say you had surgery and you've been trying to do physical therapy and it's just not recovering. Then what are your other options? At that point, it's considered a surgical option. You're going to have, number one, a sling. Number two, an artificial urinary sphincter. And then there is something called a PROACT, which is a less used option, but an option that you can also entertain. So what are these options? Well, the way a sling works is, let's say this is a continuation of your urethra. Here's your scrotum. Here's your anus. Well, there's a space between there we call the perineum. we go make a little cut through there, and we add this mesh. And this what this mesh does is it kinks the urethra, almost like kinking a hose, and it's trying to add back some of that resistance that the prostate was providing before. And by adding back that resistance, we're able to tighten up the space and potentially restore your continence and control, your ability to control your urine so you don't leak when you cough or sneeze. There's also an artificial urinary sphincter, which instead of a mesh, we put a balloon that's wrapped around this area, right? And so around the urethra, and it has a little button hidden down in the scrotum. And whenever you want to open this thing, you push this button, it opens up, you pee, and then it slowly closes over a minute. And then it tightens so tight that you don't leak. The sling is better for patients with just mild to moderate incontinence, so you leak 3 pads or less a day. You're probably a good sling candidate. About 67% of patients that get slings get down to 1 pad or less. If you pick and choose the right patients, those numbers are better. With an artificial urinary sphincter, about 94% of patients get down to about a teaspoon per day, and this is a great option, especially for men that have really severe incontinence. And so, the majority of people with an AUS do get down to maybe a teaspoon or less, but it does involve squeezing a button that's hidden inside the scrotum. Everything's hidden, you can't see any of this. It's all internal. You just learn to feel it and push it. The sling, there's no buttons to push. You know, whenever it just naturally works like a normal mechanism. So once you heal up, you're ready to go. Okay. Some of these devices can break, especially AUS, because there's a mechanism to it. So there's a lifespan to it. If it breaks, we just swap it out for a new one. There's another treatment called ProAct. ProAct is a adjustable device. So what that means is you can put a little balloon right kind of where the prostate was, and then there's a little catheter tip inside the scrotum, and you can through the scrotal wall, you can stick a needle in here and add fluid or subtract fluid to try to adjust how much water and how tight that prostate type squeezing is. You know, the biggest downfall to ProAct is that it's the most removed procedure. So out of the 3, it's the one that is most often reversed by removing it. So that's the reason it's a little bit less popular. It's also a newer treatment, so we don't know as much about the data. But in general, you do have options. I'd love for you to come in or see your urologist to learn more about some of these options and others. Okay, let's talk about erectile dysfunction. Erectile dysfunction. This is the penis. These are erectile bodies inside the penis. Here's your scrotum. Here are your testicles. And when we talk about erectile dysfunction, this is something that happens about 90% of the time early on, and then about of the patients that get it, about 60% of them do recover from it, but it can take up to 2 years. On the stress incontinence side, about 90% recover, but it can take up to about a year, usually about 6 months for most patients, and sometimes even quicker than that if you were doing those Kegel exercises early on. And there are other factors that play a role, but those are the big ones. Now, with erectile dysfunction, we do frequently recommend you start things like vacuum erection devices and PDE5 inhibitors like Viagra and Cialis to start getting that blood flowing. You want to start about a month after surgery, or sometimes even sooner than that. I would go by your doctor's recommendations, but I would encourage starting something soon, because if you do nothing, what happens is while the nerves are stunned, you have limited blood flow in the penis will start shrinking, you'll start losing length, and you may get permanent erectile dysfunction just from not having an erection in a very long time. So you do want to take things like Viagra or Cialis regularly, even if it's not working, and you do want to use a vacuum to try to push it and create a response and an erection early and regularly, so that we can just keep that blood flowing until the body's ready to restore that. But let's say you're that guy that's in the 40% that don't recover. Well, what do we do? Number one, again, there is always the Viagra Cialis option. Number 2, there's always the vacuum erection device with maybe rings or clamps at the end. That's basically a big vacuum suction device, and there's a button at the top that you push, or a hand pump, and then once you get the penis erect, you can put a rubber band at the base, and that can tighten and help you hold the blood and keep you from leaking. There is There are injection options where you can put a needle in the penis. We can teach you how to do this. It's not overly painful. It's a tiny needle, and it can induce an erection. There are gel options, which means it's an intraurethral gel or a pellet that you can put inside the channel, you pee out of, and it does the same thing. It can trigger blood flowing into the penis, independent of arousal. And then number 5 is there are penile implants, which are, believe it or not, a very, very popular option and one of the only options well covered by insurances. So I think it's, from a cost perspective, it's oftentimes a better option as well. We'd have to talk to your insurance about it, but it's something certainly worth entertaining. So now, let's say you have all these options. What does a penile implant mean? It means we put cylinders inside the penis through a small cut about 2 centimeters down to the scrotum, a pump down here to the scrotum, and a little balloon next to the bladder. Usually takes about 15 minutes, 20 minutes to do. It's an outpatient surgery. You go home the same day in about 3 to 4 days. You can have sex. You simply squeeze this pump that's hidden inside the scrotum. It'll give you a rock hard erection. You'll be able to have sex for as long as you want. You'll still have all your sensation. You'll still have your orgasm ability as long as you maintained it since surgery. You won't have the ability to ejaculate, and that has nothing to do with the penile implant. It has everything to do with your prostate treatment. Typically, with radiation and surgery, you lose that ability to produce sperm. Doesn't mean you can't feel an orgasm, but you lose that ability to produce sperm. And so that's just something to note. But you'll still at least regain your functionality. Some people they consider that their man or their ability to go, and maybe even be a little superhuman by having that ability to go all night if you want to. That's it for now. I just want you to know that, look, maintain a healthy habit. Keep an eye on your PSAs, make sure you follow up with your urologist, and keep in mind that if you're having leaking, even leaking during sex, those are things that we can fix. There are even combinations that we can do at the same time to try to fix multiple problems. So just don't forget about these problems. Don't forget there are fixes and corrections. We're here for you at 360 Urology. Give us a call anytime. Come make an appointment. We'd love to hear from you. All right. Until next time.